Um, I want to thank everybody for joining us for this Darrington Mobility Study Community Leader Kickoff. We may have a few more people come in, and Mary and Andrea, I have added you as co-hosts, so if I miss somebody along the way, feel free to let them in from the waiting room. So just I want to first start by saying a little bit about Snotrac. So Snotrac is a coalition aimed at connecting people and communities to Snohomish County and beyond with safe, equitable, and accessible transportation. And our vision is that by 2050, all people in Snohomish County, no matter their abilities or backgrounds, are able to easily access social, health, and economic services with a well-coordinated network of transportation, connecting all communities throughout the region. And one thing that we know is that Darrington is 28 miles away from Arlington and can be disconnected. And as the Oso landslide showed, that is a tenuous connection many times. But for many others, just like the daily mobility can be difficult if you have a disability or if you don't have access to a car, or as we think into the future, just being able to commute to Darrington. And so I am excited to have everybody here today for this kickoff of community leaders from Darrington and Arlington to help us identify the gaps, challenges, opportunities that we have to be able to improve mobility to and from Darrington. And I think we have a really great selection of people here today. Our agenda is on the screen, as you can see. Gonna go through a rapid fire introductions here in a moment of everybody. We'll have presentations from Community Transit, from the Snoqualmie tribe, and then homage for the Transportation Assistance Program. We will then have some presentations on the needs and opportunities within the community. I'll give a little bit of background on special needs populations. I know we have a couple other people from the county who could speak just as well as me, so feel free to add into that. Discussion about the commuting needs long-term for Darrington, and also a presentation about the Trailhead Rec program from King County, which is maybe a thing we want to think about for Darrington. And then the second half of these 2 hours will be dedicated towards discussions. You are the experts. I don't live in Darrington or Arlington, and you know your community's needs way better. And I think this is what is most important to us today. We have facilitators for these discussions. They're open-ended, everybody's voice counts. We're going to try to keep those groups small, record them so that way I can go back and watch everybody's breakouts. And then the big thing here is that all of this will be built into a study that a consultant tool design group will be putting together to identify different opportunities that may exist between Arlington and Darrington for improving transportation. And that report is due out before July. And so we're on this quick timetable to make this happen. We have this opportunity because Snotrac is funded by the Washington State Department of Transportation's Consolidated Grant Program. And we had some extra resources at the end of our biennium to spend. And we saw this as a really key priority to focus on, knowing that our connections to the eastern half of the county is really difficult. So before we get going too much, I do want to do introductions. And so we're gonna do this rapid fire. And then we'll have a couple of welcomes from our mayors who have joined us here online as well. So with that, what we're gonna do is, this is a little unorthodox for those of you who have done Zooms in the past, but if everybody could turn on your camera and your mic right now. And I know it might be a little noisy to begin with, but this will allow us to get through it more quickly. I'm going to go through my attendance, and then I'm just going to say your name, and then if you could say your organization, and then turn off your mic when you're done introducing yourself. So, and then as we go through, if I don't hear a response, I'm going to assume that person isn't here today. And then once I get down to the list, I'll go back and see if anybody who is here but didn't get their name. So let's start with, I'll start, for example, I would say my name is, I would call out my name, Brock Howell, and then I would respond to myself saying Snotrac. All right, so I'm going to start with Carolyn Neal. Carolyn Neal.
Arlington Community Resource Center, a program of Volunteers of America.
Thanks, Carolyn. Alex Hatcher.
Center for Independence.
Great. Barb Tolbert.
Hi, Mayor for the City of Arlington.
Thank you, Mayor. Carrie Matau. And I apologize if I misspeak anybody's name, feel free to correct me. I don't see here, Carrie. Sabina.
I think we're having trouble hearing you, Brock.
Mm-hmm.
Can you? Sabina?
Sabina Araya, Community Transit Planning, Blue Jacket, 2 screens.
Okay, great. Joelle Ortiz?
She's having trouble logging in. She's trying to get in right now.
Okay. Adrian Hall. All right. Ashley Bryson. Mackenzie Boyd.
Darrington School District.
Great. Tracy Frank.
Darrington School District.
Linda Nunzig. I'm not sure if I pronounced your last name correctly. Doesn't appear Tracy is with us. Or Linda is here. Linda Nunzig, just making sure. Lauren Caldwell. Sarah Gugel. Lynn Haslett.
I'm with the Division of Vocational Rehabilitation in Arlington, serving Darrington.
Great. Rankin.
Glacier Peak Institute.
Great. Tanya Tyler.
Goodwill Job Training and Education Centers for Snohomish and Skagit counties.
Thank you. Ben Kramer.
Homage Senior Services.
Erin Rashidi.
Yep, Homage Senior Services.
Mona Steele.
Homage Senior Services.
Susan Carter.
Susan Carter, HopeLink, Medicaid, non-emergency medical transportation.
Ryan Miller.
Hi there. I'm Ryan Miller with King County Metro. I'm a transit planner.
Okay. Justin Bergener.
Yeah, Justin Bergener. I'm with MedStar Transportation. Thank you.
Thanks. Wyon Perrault. Not sure I pronounced that.
Yes, North County Family Services in Darrington.
Great. Alan Picard.
North County's Family Services.
Mary Wysocki.
North County's Community Collaborative serving Darrington.
Jean Kim.
Actually, myself, Kim Pearson, will be here representing PSRC.
Great. All right. Natalie Misanes.
And the director from the Soxawattle Indian tribe.
Fantastic. Kelly Kraft. Kelly Kraft. Gary Schillhammer. Julie Vess.
North County Transportation Coalition, Stanwood Community and Senior Center, and Making Life Work.
Thanks, Julie. Vanessa Gutierrez. Stephanie Novacek.
Snohomish County Human Services Department in the Long-Term Care and Aging Unit.
Okay. Linda Nunzeg, I believe I actually called her name once, but didn't respond the first time, so maybe. Nate Nearing.
Snohomish County Council Member for District 1.
Thank you, Councilmember. Amy Biggs.
Hi, I'm Amy Biggs. I'm Snoqualmie Valley Transportation and Snoqualmie Valley Mobility Coalition and the Rural Chair for King County Mobility Coalition.
Great. Representative Carolyn Eslick.
Carolyn Eslick, representative for the 39th District.
Thank you. Misha Lujan.
Hello, Misha Lujan, legislative assistant to Senator Steve Hobbs out of the 44th District.
Danette Clemens. All right, Peggy Ray.
Delhi Valley Health Connections.
Elise Herwig.
Hello, everyone. Elise Herwig with the United Way of Snohomish County. I support North County's Community Collaborative in Darrington.
Joy Emery is here. CEO of Workforce Snohomish says there's currently technical issues.
Thank you, Brock. Working on it.
Okay, thanks, Joy. And then Mariana Hannafeld. I know you're there someplace.
I'm here, Brock. I don't know if you can hear me.
Yep.
Hi. Oh, from WashDOT. Thanks.
Great. I see Roland there. I didn't have him listed.
Yeah, Roland Behe Community Transit.
All right, who else did I miss in this process? I see a couple names in the participants list, but feel free to name yourself.
This is Susan Driver, Island Regional Transportation Planning Organization.
Bethany Kakamo with Darrington Family Outreach.
Dan Rankin, Darrington Mayor.
Thank you, Mayor.
Casey Stevens, Snoqualmie Tribe.
Thank you, Casey. All right. Well, others might join us along the way. If you would, in the chat, if you're not on the phone, I think there's only one person on the phone today. If you could write just kind of, there's going to be a lot of talking at you for the first hour. So if we could have a little bit of interaction via the chat, I think that'd be helpful. So if you could say what your favorite thing is about the Darrington area, as kind of an icebreaker in the chat, I think that'd be quite lovely. So if you could do that. With that, I've already given a little bit of introduction of Darrington. This is not my photo. I have stolen it. I apologize. Especially for consultants who have not been to Darrington, it is truly a beautiful place, small town, about 1,500 people, and is fantastic. And with that, I'd like to introduce Mayor Dan Rankin to provide a welcome, and then we'll have another welcome following from Mayor.
Well, thank you everybody for being here today. As most of us already know, Darrington is somewhat remote in Snohomish County, and embarking on this conversation is really great news for all of us up Valley. It's a beautiful day here in Paradise. It's a little bit chilly still, and we are about 2 weeks behind the rest of you guys on our blooms. Our trees are just starting to bloom, and Look forward to some great conversation today.
Fantastic. Thank you, Mayor. Mayor Tolbert.
Thank you, Brock. Like Mayor Rankin, I want to echo my appreciation for everybody that's here today. We found out in 2014, Mayor Rankin and I, the strength of our communities and what can happen for the future when we're all working together with a singular vision. So this conversation, I think, is going to be real critical to that. So thank you for the opportunity.
Wonderful. Thank you so much, Mayor Tolbert, Mayor Rankin. I'm looking forward to a really productive conversation and identifying where we might be able to find solutions moving forward. And I don't come to this with like any sort of particular idea of exactly what the solution is going to be. We're very much at the beginning here. Just another beautiful image here. Just to orient folks, everybody knows, but this is Darrington, out 28 miles from Arlington, which is the closest major town with a major medical facility besides the clinics that are in Darrington. Just a couple of, we know the highway that goes out there. There's one fixed route service, which we'll soon have a quick presentation from Sabina from Community Transit on. And there's currently no paratransit service that goes out there. And the county service provided by Homage Senior Services of the Transportation Assistance Program also currently does not serve Darrington specifically. So for people with special transportation needs, it is difficult to get appointments. One thing that we are excited to build off of in terms of success is this past summer and fall, we're able to work with the Stanwood Community Senior as part of the North County's Transportation Coalition to also identify the feasibility of providing a transportation service, a new mobility service for Camino Island through Stanwood to Arlington. And although we're still waiting for the legislature to pass its bills, we were able to, working with our current consultant and then consultant Tool Design Group, assess a couple of different mobility options to improve the transportation service. And so this is what's called a flex route service, where it has a dedicated route and then people could schedule a trip in advance for a van or bus to come and pick them up from their door to go to another, potentially to either a stop or to another door-to-door service if they scheduled ahead. You wouldn't have to schedule ahead because it is on a fixed route otherwise, and you could just go to one of the stops and pick it up. And with the funding we're expecting from the state, we're hoping that this will launch this coming fall because of being able to go through that process last summer. With our project here, I think it's a little bit different for Darrington in that we had a clear idea going into last year's study of what type of transportation service could be feasible, and the study helped ensure that it was feasible and built the credibility for a state grant application. Here, we're more about figuring out, well, what transportation service, what gaps exist that are the highest priority and what are the best solutions that we have. And so it's a little bit more of an alternatives analysis that we're hoping to embark upon for our report. And with that, we have about 6 presentations coming up to kind of outline those things. And the first that we have is Sabina from Community Transit. And I know Roland is here as well, so I'm not quite sure how much but Sabina, feel free to take over the screen.
Hi, I'm Sabina Araya with Community Transit Planning Department. Brock, can I stop sharing your screen or can I share mine?
You can start your share.
Okay.
Yep.
There we go. I think you're able to see that, right?
Yep.
I have been with Community Transit for a little over a year and a half. so I'm fairly new to the agency. Roland Behe is our Planning and Development Director. He will have, if there's any questions on the history of the agency or some of the previous year's service, we can tag team. Also with us, Alex Mean, he is in our Community Programs Division, and he is involved in one of the alternative services pilot projects in Linwood that I'll touch on a little bit later. Brock warned me to keep this presentation short because we don't have a lot of time. So if there's any questions along the way or after this meeting, please feel free to reach out. Try to condense it to the area and keep it to the services that we have currently in Darrington. A little bit about us. Community Transit has a vision of making travel easy for all, and that mission has been revised in 2019. We want to help people get from where they are to where they want to be, and that includes fixed route, but it also supports alternative services or other modes that would cater to people's needs. We know not all areas are the same, and so the purpose of being here is understanding the needs in Darrington and in North County in general. We operate 3 transportation modes, bus service. I think most of you are familiar with that in our van pool fleet. We also have complimentary DART paratransit service to our local fixed route service. We also work with employer in providing transportation demand management and educational services. And this is a quick snapshot of our service area. The area highlighted in blue represents the public transportation benefit area. A little bit about what all of us have experienced over the last year has been the COVID-19 pandemic, and that has drastically changed not only the economy, but transit ridership. During this time, the safety of our riders and employees has been our top priority. We've been working with Snohomish County's Department of Emergency Management and the Health District in ensuring that we take appropriate measures for passengers. And an example here on the slide is some of our messaging to our customers during this time to make sure that everyone is safe. Our ridership has been remaining at a lower level than the pre-COVID levels, about 60% lower, 60% lower for local service and 75% lower for commuter service. We have, initially last year, we have gone through a series of service reductions in response to those ridership decreases, but we have stabilized our service at about 85% of weekday service from the pre-COVID level. And that was our September 2020 schedule. And we've added 24 trips in March. So we are continuing to make sure that the service is still available. We know that there are many people that still need it for those essential trips. So, this is the actual route that serves Darrington directly. It's Route 230. It has limited service, and it has a round trip in the morning and a round trip in the afternoon. And this is part of the reason why we don't have complimentary paratransit service with this route. It's more of a commuter type service, the lifeline, trying to make sure that this community is connected. Community Transit is committed to serving Darrington long-term and maintaining service and mobility for the community, even through challenges like the also tragedy where we rerouted through North Skagit County and Mount Vernon. So, but again, service is pretty limited. So understanding more of what the community needs are is important in further services. highlighting some of those connections. In Arlington, additional services Route 220 that has 60-minute service, and 227, which is the commuter service to Seaway. And from Smoky Point, the most significant route is the 201, 202 that has 15-minute frequency. This route is currently under study for a bus rapid transit route, so it'll have a dedicated line, and that's our future goal line that we're planning. Other routes are 209 and 240. Taking a look just a little bit at the ridership, I know we can, our consultants will take a look at it a little more in depth, but to give you an idea of average weekday boardings, pre-pandemic, we were looking at about 22 people per day, so about 5.5, we'll say 6 per trip. And looking at 2020, so after the pandemic or during the pandemic, we're down to about 14, so 3.5, 4 people per trip every day. So there's still some service. The line corresponding is this one here. And for the type of service it provides, it is, the target level of service would be about 10. But as you see, the comparable one would be Route 111 in Briar. So limited service goes along with limited boarding. I'll move on. Our future plan, this is the exciting new developments, even though we're still looking at our financial situation and planning for ridership and studying what ridership will do and how people will want to travel in the future. The immediate milestones that we are looking at is 2024, when Linwood Light Rail will be opening. And we're looking forward to those connections at Linwood that will allow us to redistribute some of the commuter service we now have to Seattle that will then connect at Linwood. And then along with that is adding local service, especially in North County. This is something we've been talking about and wanting to do. And also we are looking at the need for alternative services. So the 2 pilot projects, or the 2 projects that this alliance this coalition is looking at and working on, the Camino Stanwood Arlington and this current project, are exciting to understand and look at customer needs. And currently Alex and the community programs team is working on the pilot project in Linwood. Some of the mobility options that they were looking at had, anything from shuttle service to TNCs to micro transit to community vans. So we're exploring a range of possibilities. Some of them are easier to implement and less expensive, like community vans, and those are some options that we would like to take a look at. Some involve contracting out with an agency, whether that's a micro transit similar to the shuttle that's in Camino, Stanwood, Arlington area, or a TNC provider. Usually solutions are not implemented all at once, so we want to see what works and we want to see what applies to each area. So this is our interest in, and we're definitely excited to be part of the planning for and planning for solutions. Yes. Our long range plan is another exciting project. This is much more long term. We are in the process of updating our long range plan, which currently goes to 2030. Our new planning horizon will be 2050 to go hand in hand with Puget Sound Regional Council's Vision 2050 planning. And what we're looking at is aligning future mobility needs, future mobility options, I would say, with community needs. So we're at a crucial point where, yes, our ridership, and we don't quite know where we are in terms of the pandemic, but we know that there's a need for transportation mobility, whether that's commuter or whether that's essential everyday trips. And we will have an opportunity for both community and public engagement next year for that effort, and we will reach out to local jurisdictions and the public to join that conversation. And I will just have this up here for a little bit. That's my contact information. As I mentioned, there's not a lot of time for a lot of information here, but I'd be happy to provide or answer any questions that may come up in the future. I see a question in the chat, which is what is the timeline for launch to launch bus rapid transit to Smoky Point, Arlington? The goal line is, I believe 2027 is the timeline. Right now we're in the scope, we'll be looking at starting scoping for that project. And currently we have 15-minute service on the 201, 202, so very, very high frequency. Any other questions that I can answer?
I'll just ask the question, the elephant in the room question, just to make sure it's on the table, which is there's only 2 trips per day out to Darrington that CT provides. From a practical standpoint, what would be the possibility of increasing the number of trips to Darrington?
I would say that depends on the demand. It is a costly service to run, and so even the trips that are there now don't quite reach the target, you know, kind of 10 people per trip need. So I would say that it is definitely an option that we should look at, especially in the context of available, what can we do in the meantime? But definitely for 2024, we have more available resources to be able to make that work if that's the demand. Mm-hmm.
I was just going to echo what Sabina said, Brock. I think that's part of why we're really excited to be in the conversation today and helping in this process, is we really want to get a clearer understanding of all of the mobility needs in the Darrington area and in the valley as a whole. It may be that fixed route transit is the appropriate future solution, but it also might be that we find a better fit to provide more mobility in the area. So I think we want to remain open to that, and that's part of why we're really excited to be in at the ground floor on a study like this.
Right. And Amy Biggs has maybe a question, maybe rhetorical, that is kind of the purpose of this whole thing. Of this whole meeting, relating to, since it is costly given low ridership, the option of using a nonprofit agency to provide the service at a lower cost and provide more frequent service. And I think that's one of the things that we want to keep on the table, and as we go to the breakout rooms to discuss in more detail. So perfect. Well, let's go on to our next presenter. And I don't think we have a PowerPoint for this. And I think she left and came back. So Natalie, are you there? And can you provide an overview of the DC Connect?
Yeah, my name's Natalie Massanis, and I operate the DC Direct shuttle bus. The DC Direct runs from the Saxo Isle Reservation through the town of Darrington, Rockport, Van Horn, and the city of Concrete. The route operates 5 days a week, Monday through Friday, starting at 6 a.m. and ending at 6 p.m. We have 2 buses operating on opposite directions. Our services are open to the public. We also do not charge any fares because we're in a very low income population. Due to not many job opportunities in our service area, we're happy to connect with Community Transit Route 230. We developed the program to also provide socioeconomic opportunities and also provide services to the town of Rockport, Van Hort on State Route 530 and Highway 20. DC Direct continues to the town of Concrete to connect to Skagit Community Transit Route 717 and 718. Annually, we've had an estimated number of 2,000 passengers. The DC Direct started operating on October 31st, 2016. We first started out with one bus operating at 8 hours, 5 days a week, Monday through Friday. We are now operating 2 buses Monday through Friday, 6 a.m. to 6 p.m. We recently just received funding to purchase 2 more buses and additional funding for operating assistance. We're hoping to expand to 12 hours, 7 days a week. We hope to help with the transportation gap between the town of Darrington and Arlington, as we've had many riders ask if there's a way to extend the route to Arlington since we started operating. Thank you for listening and have a good day.
Fantastic, Natalie. Overview of the service. Do folks have questions about the DC Connect service?
Hold on. What was that?
Oh, I was asking everybody else if they had questions for you.
Oh, okay. Sorry, it's kind of cutting out.
Brock,
Yep.
I'm sorry, I didn't hear who that was. Is there any possibility that we could get contact information in the chat box?
Yeah.
Yeah.
Oh, yeah. Natalie. If you
Oh,
could-
excellent. What's being done there?
So Natalie runs the Sauk-Suatal Tribes transit service called DC Connect.
Yeah, it's also on our tribe's website. If you would like to look at it, it's the www.soc-suatal.com.
And the spelling, maybe not everybody is familiar with the tribe spelling. So if you could provide your contact information in the chat, that would help, I think, for a lot of folks. But really great. I have a basic question, which is obviously is the tribe runs the service. Is the service open to the public?
Yeah, it is.
Okay. Great. Okay. Well, with that, let's hear from Lynn at Homage about the transportation program. And Ben, if you have a presentation, feel free to share your screen.
I do.
Okay.
Is everybody able to see it?
Yeah.
Okay. Good afternoon, everyone. I'm Ben Kramer, Senior Manager of Transportation at Homage Senior Services. So today I'd like to go through a little bit about our transportation programs, a little bit how we're funded, who's eligible to ride, and then a little bit about the limitations in the service. So our transportation programs right now consist of what we consider TAP operations or transportation assistance program, TAP outreach, ethnic meal site transportation, and Pay Your Pal. So TAP operations is our largest form of transportation, utilizing buses and vans, minibuses and vans to transport people mostly outside of the ADA service corridor. I'll go through the eligibility requirements. It costs $1.75 per ride, and is mostly funded by grants through PSRC and WashDOT, and some from the county as well. TAP Outreach is a related program where we share information about not just our services, but also other transportation services within Snohomish County to make people aware of what services exist and help people get where they need to go. our ethnic meal site transportation. We transport people to different ethnic events, mostly at the Homage's Center for Healthy Living. And then Pay Your Pal is another transportation program that actually pays for people's friends or family to provide transportation trips that are either going to work, school, or medical appointments. So our eligibility criteria for TAP in general is 55 plus. We actually just worked out some changes in our eligibility to expand our service a little bit and hopefully meet some other gaps that were there. So 55 plus, any age, who's disabled, and those are low income. For Pay Your Pal, it's much the same as TAP, other than, as I stated, it has to be for medical, work, or school. So wanted to highlight a little bit of our ridership numbers pre-COVID and then through COVID. In 2019, we provided just over 20,000 trips, dropped significantly in 2020 with COVID to just under 10,000. We're starting to see it year to date. We're starting to see the uptick. In 2019, we had just under 3,000, about 2,700, and 2020, we were actually up 100 rides over that until the pandemic hit. And then so far, we're about 2,400 rides so far as of last month. So we are starting to see an uptick, hopefully a little bit more to normal service levels. So some of the things, limitations of our current operation to help. We know that Darrington is definitely a underserved area in the transportation area. And some of the things that we've looked at as well is the efficiency of service to Darrington can pose a problem as far as if we have one driver and one bus and only one rider. It's a long trip, and we want to make sure that it's efficient and provide as much value as possible. So we've actually done a couple things so far to start looking at expanding our service in areas like Darrington. We've acquired 2 ADA minivans, which help us if it is a one-off trip, but also some of the areas that we would be going to, because it is a door-to-door service. So in some areas, you might have issues getting a larger vehicle in. So having a smaller vehicle to get into some of these areas really helps. So we've acquired 2 of those and are definitely looking at expanding our fleet more. Also, we're working on getting more interest for the programs out in these areas. So getting the word out that there are these programs so that we can maybe try to gather the information to get groups of people together, or certain days of service could be helpful, and get the most out of the service. So those are some of the limitations. Expanding service, one of the major issues is always funding. As I stated, most of our service is either grant or match, and as we expand our service into some of these areas, more funding is needed for additional drivers, additional capital assets like vehicles, and things like that, and then also to operate at maybe different hours of service. So with that, that's the end of my presentation, unless Mona or Aaron have anything to add to it. And sorry, actually it's not. Forgot about this one. So some of the COVID-19 also was that I wanted to cover. Our ethnic meal site transportation actually changed to meal delivery this year. So that was a change that we had for COVID. We increased our medical related trips. That tends to be our focus much of the time anyway. And we've actually had a contract amendment to provide vaccine site transportation now. So that's another great service we're able to provide. On total last year, we reduced to about 46 and a half, or we reduced by 46.5% the total number of trips that we performed. So with that, my presentation is done, and if there are any questions, please feel free or reach out to me later time.
Thanks, Ben. Any questions for Ben from anyone?
I have a question. I'm Tracy Frank from Darrington. To qualify for this service of TAP, do you have to meet all 3 of the requirements or just one?
So it's just one, either 55 plus or a disability. Okay. And also with the one things that we changed recently as well is previously we had stated that it had to be an ADA recognized disability. We've removed that requirement because there are some people that are not eligible to use traditional paratransit services because it's not covered by ADA, but it still hinders them from getting transportation. So certain people that have seizures or limited sight, things like that, would be able to use our service as well.
If I know of an organization that might be interested in talking with you, can I give them your information, or can you, should I just contact Homage and then your name? Is that the best way to make contact?
I can provide my information also in the chat, and that's perfect.
That would be great. Thank you.
Yep.
Hi, Benjamin. This is Lynn Haslett with the Division of Vocational Rehabilitation. So I just had a quick follow-up question to that. Does that mean that someone applying for TAP no longer has to be qualified for DART? Because sometimes they won't take them into DART if they're not an ADA.
Correct. So our attempt was to try to fill some gaps that we recognized were there, also to help people maybe are on the waiting list to start operating with TAP, so that we'd be able to help them temporarily, and then also some people are just need the service temporarily as well, and so it might be a kind of a burden to go through the eligibility process. So yeah, that's kind of the gap we were trying to fix.
Thank you.
I'm going to, Ben, this is Mona. I'm going to add something in also on the 55 plus. Usually we do limit that to people that aren't driving, if they can drive themselves, so that we can focus more on, you know, the outside needs and instead of someone who can drive themselves. So yeah, senior, but usually focus on the ones that can't drive or have a reason for not driving themselves.
Thank you, Mona. Yeah, that's true. That we're trying to service mostly people that don't have other forms of transportation.
And I'm sorry, Benjamin, I have a question. This is Amy Biggs with Snoqualmie Valley Transportation. How frequently are you going between Arlington and Darrington?
So, excuse me, right now, we're really not, and mostly due to the fact that until recently, we haven't probably had enough ridership. So Mona and I actually have been looking at this recently of going back to people that maybe we weren't serving before, and trying to get the word out so that we could create a route to go out there and help those folks that haven't been able to use the service at this point.
Is there a reason that you only, is it due to your funding or whatever, that you only do people who are eligible in some category rather than just doing everybody?
Yes, yeah, it has greatly to do with our the funding with WashDOT and our grants through WashDOT.
Great. Thank you so much, Ben. Any last minute questions for Ben before we go to the next set of presentations?
Yeah, this is Alan Picard, and I have a question. So it sounds like there's a plan and a conversation, but as far as planning and discussions today, when could we expect TAP to be available for Darrington qualifying riders?
I don't have a firm answer on that. It is something that Mona and I have been looking at fairly regular basis recently. So, and this was part after this conversation was started. It felt like a good point to participate in this and see what other solutions are out there as well, and see what the best mix of services is. So, this would definitely be part of that process as well.
Thank you.
Great. That was a really great presentation. And thank you to everybody, Sabina, Natalie, Ben, for your presentations. I'm going to jump into the next set of presentations. Mine is very quick. So we'll do that. And then we have Mayor Rankin, and then we have Ryan for King County Metro. So let me share my screen again. So I'm going to provide a quick overview of a couple of surveys that help frame the need within the community. And this is countywide information for the most part, from 3 different surveys. And, you know, there's a couple other people on here that might be able to round out these surveys since they're involved in them. But I just want to make sure that we're kind of starting with the same context. So Snotrac, every 4 years, does a transportation needs assessment survey. I'm just highlighting this, a couple of things from here. And one of the big reasons why we're having this discussion is that within areas that do not have transit service, fewer people use transit and even consider it as an option. And that's kind of like a no-duh answer to this survey question, but I think there's there's a chicken and egg aspect to it of people who live in rural areas maybe less likely to use transit service, but if they don't have the transit service, they're also just can't use it. And so you can see within served areas or well-served areas, up to 66% would have considered it, well, on a serious basis, and then on a less serious basis, up to 90% of folks, where if you go to an underserved area like Darrington, it's just the numbers are much less. So from that survey, you know, you can just see from the results that it is all factors relating to the transit service itself of a served area. Well, you can see between the two bars there, the dark blue versus the light blue of served versus underserved. But all of these there's many other options that we asked for, but the top reasons for why people didn't ride transit were all related to the transit service itself, of it not being served. There's no service in the area, to just the quality of the service being provided, which are all the other bars. And you can see for an area that doesn't have service, that number really jumps on that last bar of the first chart. Similarly, for if somebody has a mobility challenge, there's just some basic convenience of the service that needs to be considered, including the difficulty of getting on and off the bus, having seating options, the safety at the bus stops. Those things are all big factors for people with mobility challenges. The county also does a low-income needs assessment of assessing for households with low income, what their top issues are. Transportation was the 6th most important and 6th least available for people with low incomes. And so it is one of the top issues for people in households with low income. You find that one of the top issues for trying to get to services, one of the top barriers for that is transportation. I think, as we have recognized for a couple of people on this call today, that sometimes access to a computer or just broadband service is also a barrier for folks in a rural area as well. And so you see that as even a greater barrier than transportation. From that same survey, again, transportation ends up being a major issue for getting to medical appointments, whether it's medical care, to treatment, to dental services. It is one of the top barriers. If it is also a major issue for just the ability for somebody to keep a job. So of households with low income, transportation is the #2 issue behind having a physical or mental disability. This is self-reporting, but the sample size is quite large on this survey within the county. And then finally, there's a county survey that looks at the needs of the older population. And again, it is a top 5 issue. Transportation is a top 5 issue for people who are older. And some of the challenges for older adults is just, that not wanting to rely on others for transportation service can be a barrier, or it can be a challenge for folks. Not being able to afford it. Obviously, older adults tend to be on a fixed income. And various, I'm not going to go through the whole list here, but you can see that some of the top challenges. This becomes more of a pressing issue because the county is aging faster than the rest of the state, according to the State Office of Financial Management. And I don't have the numbers, but generally rural areas tend to be aging faster than urban areas, the population. So this would be an even bigger issue for a place like Darrington. But maybe as new jobs come to Darrington, the trend actually changes for Darrington. Finally, on the opportunity side, I already mentioned it, but we're here trying to find the opportunity for what type of service to provide, and one of those services might be a flex route type service, and Homage just went through kind of some of the opportunities, and there might be other things to look at in terms of meeting these needs. In terms of, I'll leave some time for questions. Does anybody have questions or comments regarding kind of the needs of Darrington or the county before we jump into Mary Rankin's description of the Wood Innovation Center?
Brock, I do have a question.
Right.
I'm curious if you shared those first 2 or 3 surveys. I'm curious if the proportion of respondents who were from rural areas or were representative of tribal populations or folks of color. Do you know if these numbers, really reflect rural areas, or did you have a larger number of respondents from Everett and Linwood and kind of those more populated centers?
So I don't know the numbers off the top of my head. I do believe, and Mariana, maybe you do, who she was in my role back when the survey was conducted. My understanding is the underserved area was oversampled within this survey, within the Snotrac survey.
Okay.
I'm not sure there is other demographic data tied to any of the 3 surveys regarding race.
Okay.
Certainly income was one of the, as you saw. The sample size for the Snotrac one, I want to say was like somewhere like 600, and then the other 2 were one was like 1,800, the other like 3,600. So very large sample sizes on those 2.
Cool.
Yeah.
Thank you.
Yep. Okay. With that, Mayor Rankin, I'm going to turn over the mic to you.
And I'm not sure where I'm supposed to go at this point. So far, great information. It's, our hope is that we put this information to good use. And how do we do that in the confines of budgets and everything else that goes on in our world today? Brock, what did you want me to cover at this point?
Well, what I would love to know is, and I think have everybody else know, is more about the Wood Innovation Center, because there's a current population that we understand today for Darrington, or we're trying to understand, and that we have 1,500 residents or so within Darrington proper today. In the future, in 3 years or so, there'll be 150 new jobs with the Wood Innovation Center. So that's 10% workforce of the current population of the city, which, in the city of Seattle is a little bit like Amazon showing up. And putting all sorts of new stress on the city in the city of Seattle, which we experience around householding, around home prices and transportation needs. And so it's a much smaller location in Darrington than the city of Seattle, but you're gonna face similar issues at a smaller scale. So I'd love to learn more about the Darrington Wood Innovation Center, and kind of just your thoughts on the commuting patterns moving forward.
So the Darrington Wood Innovation Center going to have about 150 direct jobs. There should be about 35% of that figure in indirect jobs. Not all of those indirect jobs would be in our community, so the numbers pretty big. We designed the placement of the facility close to town, but also will have access to the White Horse Trail and SR 530. So there will be opportunity to bike, walk, or use other alternative transportation to get to work or to and from the site. The jobs that are coming with this are from entry-level jobs all the way to engineers and architects that will be required on site to do the work and it'll work out of that facility. We want to look at a facility that is fully operational by late 22, early 23. And so those jobs are going to be coming down the pike sooner than anticipated. The things that from the town's perspective, the things that we've looked at as far as population growth is that we have about 50% of our population commuting out of area every day. Those folks go as they go as far as Seattle and Bellingham on a day-to-day basis. What we hope the center will do is create jobs, meaningful jobs in folks in our community that some of those commuters will choose to work here rather than be out of area. As we all know, people that work, live, and play in their community are usually a lot more engaged in other activities that are going on in our community. They join the school board, they become part of commerce, they coach or do all kinds of other things. And so when we're trying to bridge part of that employment gap through attrition through our own community. We don't think that is a complete 100% realistic. So we have been looking at, we have a growing population as we speak, and looking at how we're going to house people going forward. And we have about a year to put that to use. So that's kind of what's going on at the Wood Innovation Center and our projected timelines. This does add a new dynamic. There's other aspects when we talk about public transportation that, I think are important conversations to have here. The one off the top of my head is what comes out of Olympia as a fuel tax or a carbon tax. Rural folks drive a lot. We have to drive to get to dialysis. You have to drive for other medical needs. We have a clinic, but if you need hospital care, you're going to be leaving here. There's just a lot of demands for rural people to drive a lot more for the same kind of services that our urban and suburban counterparts have, from shopping and shopping opportunities to medical services, or if you live outside of city limits, you have to go to the county to do any permitting. There's just a myriad of things that aren't on an equal footing, and so transportation and public transportation is an important link to our communities.
Thank you so much, Mayor. Do folks have questions about the commuting needs, the Wood Innovation Center? Okay, well, it's probably one of the most exciting things that has happened to Darrington in quite some time. And is part of the picture as we move forward. With that, Ryan, for those of us who do not live in Arlington and Darrington, I think probably our biggest interaction with the community is on our way to go hiking. King County Metro has piloted a program, and I just wanted to introduce all the transportation options to the table, to the discussion. And they have this Trailhead Direct program to help people get out to the trails. And maybe that's an idea worth exploring here in Darrington. So Ryan, take it away.
All right, great. Thanks, Brock, for having me, and thanks everyone for inviting me to be a part of this. I'll talk to you a little bit about the Trailhead Direct program. I'll try and keep things brief and breezy, and if you have any questions, I have my information for you to be able to reach me afterwards. In terms of who I am. I'm a transit planner for King County Metro, largely focusing on fixed route service. But in my first few years at the county was spent doing alternative service and working in communities where fixed route is a good option for folks. So I'm happy to see this kind of collaborative planning taking place all over the region. So the background for the Trailhead Direct project, this came from a need that we saw through our King County Parks Department at a couple of major trailheads in the Seattle area where there have just been massive parking congestion problems and such that folks were illegally parking across, like along the sides of highways and walking along busy highways with no pedestrian facilities. And it was really creating an unsafe environment out at the trails. And so we were brought in to help understand and mitigate that kind of congestion issue at major trailheads. And so we wanted to, ease that vehicle congestion that we saw out at our trails, reduce those safety hazards. So hopefully by providing other options for folks to get out, we could, reduce that illegal parking. And then just more broadly is expand access to these hiking destinations. We know that they're popular and we want to provide more mobility options for people to access the outdoors. We know that there are lots of health benefits that we see for people accessing, being able to get outside and move around. And oftentimes transportation is a barrier to folks. So in 2017, we had our initial needs outreach where we worked with parks, we worked with a lot of members of the outdoors communities, a lot of, including Washington Trails Association, including Outdoors for All, and a lot of outdoor focused organizations to understand transportation needs and understand those barriers and gaps and opportunities that we could go and meet that. And, we wrapped up that outreach in the spring of 2017, and we had just enough time to do a short little trial run of what we called Trailhead Direct, going just within the area around Issaquah, which is a inner ring suburb of Seattle, to a couple of very popular trailheads out there. We had just a 2 or 3 month pilot, from basically August, the end of August, like the beginning of August through the end of October. So a 3-month pilot there. And what we learned in that was that, there really was a lot of latent demand. We had a lot of interest, both from the community and from the media, that really drove about 1,000 people to using that service in that first year. With that, we really recognized, and part of our work is understanding how people were using that. And oftentimes we had thought, oh, this is going to help mitigate, like provide people a kind of satellite parking opportunity and then take transit in. But what we found out through talking to the community is that there was really a larger interest in people being able to get an end-to-end trip. And most of about half of our ridership that first year were folks who didn't have access to a vehicle at all. And with that, we were able to use that and expand the program out to, instead of being, from an inner ring suburb to trailheads nearby, going directly from major rail stations in Seattle all the way out end to end to our trailheads. And with that, we saw ridership just completely explode, where our ridership more than tripled in that first 2018 season. And we were able to bring in private partners who were interested in promoting and growing the service. That also allowed us to work with the city of North Bend, which is kind of a more rural community about 30 miles out of the city of Seattle, where, since we were bringing service from Seattle all the way out into there, we were also providing a benefit for that smaller community. And the city of North Bend was really excited to work with us and partner with us from that kind of economic development standpoint. It was a seasonal service, but it provided service to the city that had very limited transit service during the week. And so during the summers, we were providing hourly or half-hourly service for this community, which was really a value add to them. And they had an interest in looking at in kind of the economic development side of that. We ended up further expanding service in 2019. We added a 4th route. We increased the frequency on our services that remained again, we're able to pull in outside partner funding to help promote the service and bring in and drive ridership to us. And part of that work, and again, that 2019 season was the last season we ran because the 2020 season was impacted by COVID, so we did not run that for safety reasons. But one of the things that we found through this is that we really did drive a lot of people who wouldn't have been able to access the outdoors and also access these rural communities. 70% of our ridership didn't have access to a personal vehicle at all and would not have been able to access the outdoors or access these areas were it not for this service. We also realized the importance of having this service for reasons that were beyond what we had initially thought. About a third of our riders, when we did, end of season, mid-season and end of season surveying of our riders themselves, about a third of people were not riding it to access trailheads at all. They were riding it because, we advertised it as part of our transit system and it was in all of our data systems. So folks who were just looking at getting from North Bend to Seattle or to any of those locations along our routes were able to just see that this was a transportation option for them. So, a third of our ridership were folks who were visiting their grandparents in North Bend or or just getting from North Bend to a job in Seattle or to activities in Seattle. So it really had this kind of fringe benefit there. And it was also just a very popular service for us. So, what started off as this service that we thought was just about mitigating parking really became a much larger service, and the goals became much broader and more about access for communities in general. So I'm going to leave us here with my contact information as well as my contact information with my Parks colleague, Ryan Dotson, who can speak a little bit more to that side of things. I see that there were things in the chat. Let's see. Oh, yes, if you build it, they will come.
Yeah. Ryan, great presentation. Thank you. And thank you for the service that I've used. Are there questions from other folks about the service?
I have a question, Brock. From the community transit standpoint, we don't have an I-90 in Snohomish County, but we do have trailhead access, most of them on gravel roads, other than Highway 2 and some trails over on the south end of the Mountain Loop. Would community transit look at going out US 2 to the pass and to, Verlot or beyond Verlot and, and on the north end of the Mountain Loop?
I would say that we can take a look at it. And it depends on what the demand is, right? I think if that's the need for the community, we could look at what kind of vehicle, what would be the frequency, things like that. What is the similar to what the study would do, yeah. But I don't think we would want to eliminate anything off the table in terms of options. And we do have lots of vans available. So I think that, the idea of a community van that we are looking at in Linwood is also something that can be successful for those types of things too.
That'd be interesting. The nature of community transit versus metro is a little different too, right? Because the service area of community transit, the taxing district, is not the entire county, where metro is the entire county. And so they have different partnerships with their with King County Parks or their county DNRP, because they're serving another agency's needs within their county administration. So that's interesting. It's just something that we got to work through. That obviously community transit serves outside their service area and go in commuter trips to downtown Seattle, for example. So, well, so this was the end of our presentations. Thank you all for sitting through this. What I am most excited about now is to have conversations with you. And to help facilitate that, we're going to break up into smaller groups. And this is the part that I'm most nervous about in terms of facilitating this, because I need to set up the breakout rooms. We're going to do 2 breakout sessions. The first, we're just going to talk about you as an organization, what you have seen and experienced in terms of mobility gaps and challenges. And we want to get them on the table. For example, we haven't really talked about medical issues from the perspective of the hospital. And I think that's one thing that I want to hear more about. And there's a whole set of other things that I would love for you to talk about. And then the second session is going to be about solutions, about what opportunities may exist. If you have a pot of money within your organization that you're ready to fork over to help provide a transportation service, we'd love to know that. Or if you are an agency that you feel like, yeah, we want to provide a transportation service and be the one who runs that program, then love to hear that as well. But it may just be that, hey, I know of this state or federal funding pool that we want to get the money from. So we're gonna do 2 breakouts. We don't have the full time as I expected. So we'll do probably 10, 12 minutes and then do a report out from that group and then do the second breakout session. I'm gonna start breaking folks out. We have facilitators. I'm hoping Alan is still on the line. Mary is still here. I'm still here. Andrea, Valerie, and I believe Andrea, Aaron, and Rachel. So I'm going to break you all out into 6 groups and go from there. Okay. Breakout rooms. Let's see. I may end up having to do this all manually, which will be very painful, but we'll get through it. Right. I am hoping this is going to work. So if you would, I'm going to open all the rooms, and then if you could just select a room on your end when we do this, and then try to have no more than 6 people in any room as you select it. So if a room hits 6, don't choose that room. All right. Hi, Barbara. I'm going to try to, I'm going to have to assign people. So I'm just going to.
Yeah, I don't think it works any other way that I know of.
Yeah. see how I did. All right. We're all here. Great. So we should have Mayor Tolbert, myself, Carolyn. Carolyn, so why don't we just do a quick round of introductions again? So everybody knows me, you've been hearing from me. Mayor Tolbert, you want to do a quick introduction again?
Hi, Mayor Barb Tolbert from the city of Arlington.
Great. And Sabina?
Sabina Araya, Planning Department, Community Transit.
Great. And Kim Pearson, PSRC.
Yes, that's it.
Carolyn?
Caroline Neal, Site Director for the Arlington Community Resource Center, a program of Volunteers of America.
Great. And Sabina, are you also the phone number of 425-320? Okay, so that's somebody else. Would the person who's on the phone like to introduce themselves?
That is me. This is Wyoming with North County Family Services in Darrington.
Great. Perfect. So this is a little bit of an open conversation, and it's going to be harder for Kim, Sabina, and myself to like really engage on this and in figuring out what the gaps are. So I'm going to be relying on the other three of you to help identify from your perspective what the gaps are within the community, as you've heard or you've seen or experienced. So why don't we just open it up first? Carolyn, maybe you could talk about what gaps you've seen.
So I feel like I have a little bit of a unique perspective because I also, beyond the clients that we see here, I also live in Darrington and I grew up in Darrington. And I was a user of the community transit for many, many years when I was growing up in Darrington. And unfortunately, the way the bus route is scheduled now, it's just not feasible for a lot of families to use. Not just there's only so many jobs in Darrington, so people obviously have to look outside of Darrington. And if your job starts at 9 or you have an appointment down in Arlington, you're going to be down there all day, which makes it really prohibitive for people with families, and just people being able to get to and from work on a reasonable basis. You know, unfortunately, I think that there's a lot more people that would utilize the bus system if it was more accessible.
Yeah. It's definitely one of those things of people won't cross a river unless there's a bridge.
Yeah.
You have to provide the service. And providing only one route doesn't make it all that convenient for one daily trip.
And I would say that people that engage in utilizing public transportation, if they're starting from a place they haven't utilized it before, the expectations never match the reality of service. And so that part of that learning curve, I mean, when I talk to people in my community and in the community of Darrington about transportation, to them, it's like an Uber type transport. I call it, I get it, I go to where I need to go. I don't have to worry about getting my task completed in a certain time to catch the bus going back. I can't tell you how many times I've driven people back from the grocery store, you know, on the weekend back to Darrington because they missed waiting in the checkout line. They missed the return bus. You know, usually it's older women and they break into tears and you feel like you need to do something to help. But I just don't feel that there's a realistic expectation of what people get from public transportation when they first start using it. So that whole planning cycle of how they have to plan out what they're going to do.
Especially where service is limited, where that becomes an issue.
And it becomes more critical when we talk about communities that are so rural, they have terrible broadband services. So the transportation is that critical infrastructure link where other communities might just do telemedicine or things that they can have access to because that infrastructure is in place. So I think we have to look differently at communities that are missing more spokes in the wheel.
This is Wyoming. Can I jump in for a moment?
Yeah, absolutely.
Oh, thank you. And I appreciate everything everyone has said. And Caroline, I so appreciate your perspective as well, because as you know better than anyone, because you grew up here and still live here, the limited transportation issues create multiple problems that I don't think people look at. For instance, and it really is that, you know, egg and chicken or whatever that saying is. We have people who don't use WIC because they cannot get to WIC with their 5 children. It is impossible, and you all know that. But then when we call WIC, it's kind of like what I heard before, and I'm not trying to throw anyone under the bus, but I did get a little bit cranky when someone said, and I'll leave it out because you all heard it too, well, we haven't had the ridership. It's like, oh my gosh, another colleague is sitting here with me thinking, please don't ever say you haven't had the ridership. We don't know how many times we've called to try to get rides for our seniors, and we can't get any rides for them. So like others, we're the ones who are transporting people on weekends and in evenings. And in fact, we're taking somebody on Thursday. So we have people who can't access services that other people get because, again, we're told, well, we don't have the ridership, or we can't get WIC up there because we don't have a need for WIC, versus, no, you don't have anyone using WIC from Darrington because folks from Darrington can't get to WIC. So there's so many things that are intermingled with lack of transportation. And as you already said, broadband, I don't even try to use the internet because when our kids are in school, and they should be, and I'm thrilled they are using it, for me to get on broadband is nearly impossible. So I just now, my go-to is a phone. So, you know, so I'm not saying anything that all of you don't know, but there are so many things like going to the dentist, getting your vaccines. We're trying to set up now so our community will get vaccines. And I just went onto the site and it showed your vaccine sites within 50 miles. And of course, because I'm tired, it was like, are you kidding me? We do have a local person who's giving the vaccine. He's not even listed. But if our folks had to travel 50 miles to get a vaccine at a certain time, it would be impossible for them to do it unless they had the goodwill of Compassion and Neighbors and our Lone Family Center to take people down to that. So I think there's just so many things that are intermingled, including something as simple as shopping. And that's a big issue when we have people who are on limited diets, and our store is great. We love our store, but it's one store. And for folks who can only go to that store, that limits their capacity to get the other foods that they may need for specific diets. So it's just as we're looking at all the transportation issues, I'm so appreciative that you're doing it, but it really is like, if we have to do something because our community needs to have those services as much as anyone else. So again, thank you for letting me spout my exhaustion, and thank you for bringing this issue up. So that's where I am. Oh, the other thing I did want to mention is, while we are 12 to 1500 in the Darrington proper, I, like Caroline, live 6 miles out of town. My daughter, when she lived at home, rode the one bus into Everett, didn't get to work on time, rode the one bus home from Everett, well, obviously Everett to Arlington to Darrington, and had to leave work early to do it. So she gave up and started driving her car. So those are just the issues. It's like, yes, we have the 12 to 1500 in the town proper. We have about 32 to 3500 who could use services were they improved. Okay, I'll quit talking and go back to mute, but thank you.
Those are great points, Vyon. Thanks. I mean, I wonder when we look at communities of this size and the distance, if thinking of regular public transit route, mechanisms is the right thing. Should we be looking at alternatives that scale better and fit the size of the community? And, should it include job opportunities for third-party operators like Uber drivers or community drivers, or something where you can build an industry for the community that can be more of that on-demand and specialized type of transportation they need, and not have to worry about the convergence of the right amount of riders to, put the public dollars into routes that way.
Yeah, absolutely. I thought I'd be quiet, but you maybe heard the same conference call I did, Mayor, where a woman from Canada was speaking, and a situation similar to Darrington, the county and the infrastructure of the county helped set up Uber drivers, which created a secondary income for a lot of the folks in that community. And the riders paid $3 to go, and the county tax dollars picked it up. So people weren't dependent on a bus, or frankly, the bus depended on 10 or 20 people getting on it when it's one person who needs to go somewhere.
Yeah,
So
I
there
didn't
are a
hear
lot
that,
of-
but it just financially makes sense to me, Wyon. You know, if public transit invested in those startups for on-demand driver services or that gig economy, it's certainly a more lucrative investment to get quickly into a community to provide service.
Thank you.
So we're gonna have another 10, 15 minutes to talk about the solutions here, and certainly that is a good one. Just to make sure that we have more to report out in terms of challenges, maybe there's a personal story that we could add in here that you've heard. I've heard a couple of times of where you've needed to take a community member home because they lacked a transportation service. How regular is that? Is there a particular it'd be great to be able to highlight some of these stories in terms of being able to put a face to the issue. There's something.
I can't tell you that happens every month. It was just, it happened to me twice.
Yeah.
So how many, I don't know what that is representative of anything and how many people that, it's non-scientific that way. It's just anecdotal data.
Well, Wyon, it sounded like you had a similar story to that.
Oh yeah, yes, absolutely. And we could start tracking the data better. Again, we're taking people places at least weekly. And we were thinking about taking folks shopping weekly as well. We also have, fortunately, even for the virus, we're either transporting people over to our local pharmacist or he is going to their home because there's no other way for our folks to get there. So we're taking we could take many more than we do, but we're transporting people, probably at least 2 people weekly to different sites, different locations at different times. And it could be much higher. We just have a limited capacity to do that because there are 3 of us working on site and we have our own vehicles.
Yeah.
Oh, and I have an acquaintance up there that had to quit their job because there's not late night childcare in Darrington that accepts state subsidies. And when you have to go outside of Darrington to find a job, and then by the time the bus gets back to Darrington, the daycare's closed, which means you have to hire another babysitter to pick up your children to take them home. She couldn't keep doing it, and she was a single parent. There was no other option for her. She had to quit her job.
That gets to the compounding factor for sure that we've heard about. I'm gonna close in maybe about 2 minutes. And I have, since I'm running all the groups, I have to send a message to them. Are there other gaps folks want to highlight here? I mean, so what I've heard, obviously the compounding effect, the broadband is a major issue for all sorts of reasons, but one is scheduling trips, just like being able to know when trips are happening. We have an expectation of transportation service. I think, just running our daily lives, we expect that when we need a transportation service, we can make that split-second decision to be able to get someplace. And so, the Uber-like service, or just maybe it's more of like the experience of owning a car, the freedom that you get of owning a car. It's hard for public transit to match that. My apologies, the dog sitting. The dog sitting. We have community members assisting others, obviously, and all sorts of issues highlighted regarding the vaccinations, shopping, being able to hold down a job because of transportation services, being able to rely on transit to get to a job.
I've heard, depending on where the job is, if it's further south, there needs to be more time built into those connections to allow people that 8 hour of work in between trips, and that seemed to be a challenge.
Yeah. Okay. Good. Well, thank you so much. And Caroline, Mary Tolbert, Wyoming, great insights provided. And hopefully in the next session, we'll talk a little bit more about maybe an Uber-like service that could be provided. Or, thinking about what Homage could provide and be enhanced with, or what community transit's pilot projects could be. All those things could be on the table.
Thank you so much.
Yeah, thank you.
I was on mute. Hopefully the others come back.
We've been yanked out of our happy place.
Sorry. Sorry that you're having good conversations that I pulled you out of.
Oh, you know us. We're always going to have that kind of conversation.
I'm a one-trick pony, man. This is all I ever want to talk about. Seriously.
Great meeting, Brock. You're doing a terrific job.
Okay. If we could, each facilitator, if you could highlight one thing from your group, because we don't have a ton of time, and I want to make sure we have enough time to talk about opportunities and solutions. So if we could go around each facilitator mentioning one thing. And I will lead off in that there's from our group, we highlighted that there's a compounding effect of not being able to have good transportation service, that people aren't on WIC, that they can't hold a job, or that the connection doesn't work for them and therefore they're not using transit, that just a range of compounding effects of not having good solid transportation service in terms of how social services are being provided. So that's my one highlight. Mary, let's go to your group. Or if we don't figure out the mute button, we can, we'll come back. Andrea? Yeah.
Sure. In our group, we talked about a number of issues, but some that are worth highlighting here are the challenges for people who are seeking healthcare services, but also just kind of general services for working people. Many people are involved in industries that are more manual labor types of industries and require physical therapy or other kinds of regular care. And there's there's that component, and then there's the sort of life-sustaining care for example, people who are on dialysis. Something that I had not thought about previously was just accessing the court system. So, we talked about some other issues like broadband and access to employment, which are also important. But even those other things like the court system is also something that is challenging for folks to access.
Thanks, Andrea. Mary, we'll go back to you.
Thanks, Brock. So
Ultimate transportation for folks with disabilities and our seniors. The other piece of it is that when we work in the field of social services, it's very stressful for folks to be worrying about navigation when they need to be somewhere. So just that component of trying to work through transportation when you're already stressed trying to get to court or try to get to methadone clinic or to get to social services is a tremendous stress.
Yeah, okay. Let's see here, Rachel or Aaron? Well, let's go with Rachel. Yeah.
Sure. So we were in room 3 and had a lot of good conversation. I think one of the particularly interesting things we heard was that specific to students and after school activities, you know, students often will rely on their friends and family to drive them back and forth to, you know, athletic events and things like that. A lot of folks live, you know, between 5 and 15 miles out from the school. But for those families that may not be able to afford gas, some students may be missing out on participating in some kinds of those events. And we also did talk about kind of access to medical and social services. And I think one thing that came up that would be important to note is just that though there are a few medical clinics and a dental clinic within Darrington, they don't necessarily all accept Medicaid or the Apple services. So that's kind of another barrier for those folks.
Yeah, that's an important point. Aaron, I forget if I combined you with somebody else, but I think you had your own group.
I did. Yeah, we were in group 1, and thanks to my breakout team members. Yes, we had a good discussion, and I would say if I could boil it down, some of the new things that I think were interesting that we talked about was actually bringing a little bit of the services up to Darrington. I think we had a lot of discussion about how because there's one like very powerful directional demand driver thing happening, you know, of moving people between Darrington and Arlington. We talked a little bit about some of the challenges of sort of bringing things in the other direction, of bringing opportunities, whether service opportunities or economic development opportunities, actually up to Darrington and trying to sort of flip the model a little bit. So that was kind of an interesting outcome. And then just a lot of discussion, I think some things that other folks have said that have really resonated just about sort of the lack of resiliency and alternative routes and some of those trade-offs that you make about having access to vehicles and things like that. So.
All right. I want us to make sure we have time for the next breakout. So Valerie, Andrea, Alan, I'm gonna hold off before we come back. I'm gonna break us into the next group so we can chat about opportunities and solutions. And then we're gonna have like 5 minutes here to talk about them. Then we're gonna pull back to the group again and we can do report out then. I'll make sure you get reports at that point. I am gonna do something risky here. I'm just gonna divide us up. So facilitators, I may need to reassign you after I do the automatic breakout group to get you to a good space. So we will try. I just want this to be as quick as we can do it. Actually, sorry, we can just go right back to the same rooms. So here we go. And yeah. Do we have Wyoming still on the line?
Yes, I am.
Great, perfect. So it's not just agency folks here. Well, so I would love to think through some of the opportunities that might exist. And we started talking about like an Uber or on-demand like service last time. As potentially even creating local jobs as part of the process. Any additional thoughts on that, Carolyn and Wyoming? Or, yeah.
It's a low income community for the most part. Uber to drive to Arlington and back would be very cost prohibitive.
Yeah.
Well, that's
There
where
are-
we had the opportunity to listen to somebody out of Snotrac Institute who they give conversations worldwide, but through our United Way program, Snotrac Institute came and spoke, and well, they didn't come to speak, it was virtual, so thus I was on the phone, but she spoke about how getting everyone involved, much like you're doing. So again, thank you. It allowed people to say, okay, let's look at those tax dollars, much like Mayor Tolbert was saying, how can we utilize those dollars, create a job or two in the community by those tax dollars paying an organization or an Uber type driver those dollars and have the participant pay free. So it wasn't a traditional Uber driver, but that's who this little group in Canada went through, utilizing their county government to say, how do we improve the transportation? So it really was a group of people working together in a very short period of time to say, we can make this happen, and we can help that to go, right? So
yeah,
I think
exactly. Scale it to the size of the community and the need. So Community Transit has the DART bus, but they struggle to reach those outlying communities because of the time it takes. But if there was somebody embedded in the community that provided that service, they get the advantage of knowing the community, probably knowing the people. They could even begin, if they're transporting people to work, to assemble carpools or things like that. But is this a place where you could start to really look at a microcosm of the issues that impede in that community?
Exactly. So, and the Snotrac Institute, again, very knowledgeable how, I think she probably lived there, the person who was speaking, or had lived there previously. So it really was this great opportunity to think outside the box that we normally would, to say, okay, what is a way that we can do this? Because as you all know, and Caroline too, because she again is my neighbor, how can we utilize those tax dollars that are going to transportation and get those tax dollars that are going to transportation to serve the Darrington area community, Darrington and Arlington community? So, you know, it's a cost breakdown, it's figuring out how to make it happen. It's having people be willing to maybe give up something in order to gain something. But I think, again, all of us who are in human services and working on a shoestring or in smaller communities know that we can make something happen. We just have to get rid of the we can't make it happen to how do we make it happen? How can we create a timeline that we can make this happen over the next year? And I think it can be done. I mean, she was really inspirational in saying, no, we can do this. Let's work with you and make this happen. So mine is, let's work with you and let's make it happen. I'm excited.
Awesome.
A few solutions that were talked about or were considered in the Linwood project and in the Stanwood one too. Microtransit, it's one, you know, there's operators that offer that as their own thing, or it can be part of a transit agency. There's the smaller vehicles that can go on different roads, but they're smaller in size, so kind of a scaled version of transit, a little more flexible. The community van solution was also something that came up as the Linwood pilot project, and it's basically having vans available for people to actually take them and offer trips or drive them themselves, or for larger groups. That's one thing that we thought about also with Trailhead. Usually if you have bigger people, a bigger group of folks, and you want them all to not take all the parking space away, that would be a good solution if the city would be willing to partner in that. I know that we have vans available, especially now. And of course, adding more fixed route service is definitely always an option in terms of solutions. And it's a matter of, you know, who is taking the bus and where do they need to go, and how many folks are having the same problem. So,
you know, Sabrina, we see that happening. I see it happening in Arlington all the time, where the senior living communities have their own vans and they transport people to shopping or to medical appointments or something. So as a community goes larger, you have private market that will provide those outlets for people. But in the smaller communities, sometimes it takes a jump, like Wyona's saying, from a certain point to introduce those concepts into the community.
Yeah, I'm curious whether we'll actually come up with a suite of solutions, right? That there's probably not a one size fits all or a silver bullet approach to this, that there's multiple needs. And so we'll need to figure out like what the right mix is. Maybe adding one more trip per day, one more round trip per day is key for making the commuter option work. And then for people with special needs, there's more flexibility that's needed. And so,
is it feasible, Brock, that that they would add one more trip a day with 3.5 ridership on the trip that they have? That's why I'm just saying, like, really seems like we've got to look at alternate solutions that, have a cost benefit to them greater than what, just asking a public transit agency to maybe go to 1.5 ridership per trip.
Yeah.
I had, we do have cost per rider information, and obviously it's a limited service with 20 people or 14 people a day. The cost is about $60 or a little over $60 a trip right now.
That's pretty high. Yeah.
Mm-hmm. So if you put half that investment into a micro solution, everybody's coming out better.
Yes, and I'm curious on the Camino Stanwood Arlington solution, what the ridership will be and what the cost per rider will end up being, because sometimes you implement a solution, it might be more expensive, so you might want to rethink the strategy afterwards.
Yeah.
So it is interesting.
Mm-hmm.
Yeah.
Also wondered if there are other alternatives like, the bike shares or the scooter share organizations for more in-town, more mobility, or that first last mile type mobility. I'm looking at it in Arlington just with the addition of Amazon, because I don't need all those 1,000 employees on the road at lunchtime.
Yeah, there's definitely companies out there.
This has been a great breakout. Well, we are right at 2 o'clock. I would like the opportunity for the two groups who were not able to report out last time to report out this time. But we did take notes, and I recorded my breakout. I'm hoping the other facilitators recorded their breakouts. And so we will be able to take your input at least through the notes and put them into the next steps. And then I want to offer you a couple of opportunities. So, but we'll start with Alan as a report out from this group. I think you double clicked your mute button.
Thank you. I think the things that came to the top were to really understand the difference of the commuter story and the human services story, to look at building a transportation coalition of sorts where the tribe takes a larger role, and the Snoqualmie as well. And then to do a little more exploring about right size servicing. Could we actually run 4 small vans instead of 2 huge buses on a daily basis? Amy, do you want to add? I know we're short on time. Amy or Mariana?
I can just say that in a rural area, it's really important to right size the services and not focus as much on services where some people are eligible and others aren't, in order to avoid duplication and find a way to work with someone deeply embedded in the community in order to provide the services as a contractor to the large transit companies, because nobody does rural like people living in the rural area. I mean, in terms of marketing, outreach, everything else that the big bus companies may not have and have been longing for a long time.
Yep. Great. And obviously we're still collecting all the feedback, so I'm sure a lot more was talked about, and we'll get that as part of it. And finally, I'm looking at my screen where is the last person. Maybe has left us. Is Andrea or Valerie still here?
Valerie and I were in a group
Okay.
together.
Okay.
And the other Andrea and I were in a group together, and we did our first share out already.
Great. Well, with that, thank you so much for being here today. There is a couple of things that for us to continue the conversation. And I'm going to share the screen again. So first thing, we would love your continued involvement in this effort. We are using the North Counties Transportation Coalition, not to be confused with the North Counties Community Collaborative, this is a project of similar organizations for the same region around transportation issues, and they will help guide as a steering committee the production of the report. Our next meeting is on April 20th. We'd love for you to be there. Let me know if you want to be there, and we will make sure that we add you to the invites. And then we will be doing a community survey. We have it drafted and we need to finalize it. There will be a Spanish language version of it to distribute as well. Mary has done an amazing job in terms of lining people up for helping to do some in-person work of doing the community distribution. We'll be sending a mail card to every household within the city, within the town of Darrington proper, to encourage people to take the online survey, and we will make sure that's done that way. But probably the best way to get people to take the survey is for organizations like yours to send it a link and a little bit of text to your email distribution lists. It is an online survey primarily, so having it come from your organizations would be really key. So if you are willing and able, we will share a link to the survey with you as a follow-up, and we hope you will commit to sending it out. With that, I want to thank all of our facilitators from Tool Design Group and Broadview Planning, and Mary Wysocki of the North Counties Community Collaborative for helping run this meeting and make sure that this is great. And we look forward to your involvement moving forward. I think there's a lot of opportunity here to improve things. Obviously, there's already transportation providers in the area, and to some extent, it's just a matter of either resourcing them more or figuring out how do we pool our resources in a way that delivers a better service for Darrington. So thank you so much. If anybody, I'm happy to stay on, but we're past time, so feel free to go or to hang out and ask questions.
Rock.
Yeah.
Thank you.